transforming healthcare. Today we've got a few esteemed guests. I'll introduce them quickly and then we'll jump right in. We've got Dr. Ajit Menon, who's one of the eminent cardiologists working at Breach Candy Hospital, but has also been a well-wisher of IKS, and so pleasure to have him on board. And then we also have Dr. Janvi as well as Dr. Pooja, both of whom have been physicians with IKS for 3 to 4 years. So we'll hear a little bit of from them on their experience as well. I think today's topic is going to be centered around clinical documentation, and we'll sort of unpack that a little bit for you as far as what that means. So I'm going to first start with Pooja, you and Janvi, in terms of sort of the notion of clinical documentation, and as you came to IKS with not having so much of a background in doing that, what has been your experience, and what are the parts of that work that you enjoy? So if you can help us with some sort of commentary around how that journey has been for you, I think that'll be helpful, and then we'll go to Dr. Menon.
Sure. So Dr. Nikesh, thank you for calling us here on this platform. It's great to be a part of this, and it's definitely it's great to be a part of IKS as well. Being into 8 years of clinical practice, moving on to a non-clinical role. However, keeping one thing in mind, that there would be, it is definitely related to our profession, managing physicians and patient conversations, helping them out with the documentation, as well as having updated with the current protocols, the overall, how things work at the US healthcare has been a great learning experience overall. And in IKS, I suppose, my journey was like from a team lead to assistant manager, now managing some specialties here as a specialty center of excellence. So that's been a really a wonderful journey overall with respect to managing or talking to our client physicians in US. It's a great pleasure to work on specialties, have a new part of it, putting our knowledge into it, and enhancing it. So that's a wonderful thing where with multiple specialties having with us, that's a wonderful thing which I feel that's the best part. I enjoy working.
And does your medical background help you do better clinical documentation? How do you think about that?
Yes, Dr. Nikesh. So it is easy to decipher things, meaning, we know the pathophysiology of the conditions, the line of treatment, the drug interactions, or the side effects of the medication. So it is it adds value to the documentation. It's a medico-legally accurate documentation that we can help out with. Also, if we find some discrepancies in the data, it's something which, being from a medical background, having that understanding of the subject matter, it really helps there.
Okay, thank you. How about you, Dr. Janvi?
Yes, so definitely our medical knowledge helps us because, as we are handling a team of scribes, and the scribes are listening.
Oh, I think we lost Dr. Janvi. No problem, we'll wait for her to come back. But Dr. Menon, let me come to you. How do you see, given that you've been sort of practicing medicine for many years in India, how do you see the clinical documentation, both the importance of that in clinical practice, but also how has the landscape changed or is changing in India relative to the clinical documentation?
Yeah, hi, Nikesh. See, when we were in medical school, we are taught a lot of stuff in terms of history taking, in terms of prescription writing, in terms of a lot of stuff that we need to know or understand when we get into practice. What we are never taught and what we learn as we come across is clinical documentation. And that has been there from many years. It's just that was an analog method of doing it on paper. We still had to document everything on paper. We had to still, and that was taught to us by one of our professors, who the first two things that they teach us is, one is that medicine is not mathematics. It's never 1 + 1 = 2. And the second thing is that clinical documentation is something which will save your life one day. So today you have clinical documentation in the digital era, where it's basically recording the details of medical treatment, medical tests, or any clinical this thing in such a way that it helps in compiling the patient data and giving it a broader spectrum, a much more clearer spectrum of what the person who's writing it is thinking about, and how he can convey it to the other people who are involved in the management of a patient. So clinical documentation is something which I think is extremely important, not only from the patient's perspective, but also from the overall healthcare perspective, overall medico-legal perspective in all respects. And I think it is something which has been there, and now it's getting much more refined in terms of how people store data. Now, if you look at medical practice, we have one patient being seen by different consultants, because medicine today has become so super specialized. From the head to the toe, you have different specialities, different super specialities. So when it comes to different people seeing a patient, there has to be a certain continuum of treatment from the from where you begin within in the care of a patient, to where the super specialist starts advising his treatment, and where the patient gets, the whole thing gets collated, and the information, and the patient gets a treatment which is overall beneficial to him. Now, for that, you need documentation at every point of time, and that's where I think integrating all these informations comes into play when it comes into clinical documentation. The thing is that the second part is that in terms of medical legal cases, today everyone practices defensive medicine. Trust me, medical practice is more of defensive medicine, and that's why we need notes and notes to sort of put it on record as to what are our thoughts, what is a differential diagnosis, what are the possible treatments, what are the possible investigations, and what are the outcome of these investigations. So clinical documentation is there to stay. There's no question about it. And today, with a lot of hospitals getting into digital documentation in terms of electronic health records and electronic medical records, it gets all the more complex for people like us.
Correct.
Why? Because we have come in from an era where there was nothing digital. We have come in from a pure pen and paper era, where our notes used to run into 2 to 3 pages. From there to getting it onto the digital platform and making it the whole thing completely digitized is a bit challenging for us. But at the same time, it bridges the lacuna between a person's thoughts, actions, and what are the results.
So tell me one thing, Dr. Menon, like you said, there's certainly some benefits. And like you said, even as the medical legal, from that perspective, it becomes important. But for a busy doctor like you, right, who's got surgeries, who's got a busy OPD, where are you going to find the time to do all of this documentation? And do you envision that, like we are seeing in the US, where a lot of doctors, while they subscribe to the importance of clinical documentation, would love for somebody to do it, right, and keep it ready so that they can get the benefit of that, but not take time away from patient care to do that? And do you see that in India, somebody like you may over time subscribe to that and say, you know what, I love all of this documentation. I personally don't have the time, but if somebody is able to do that for me, hey, great, I'm willing to pay for it. I'm willing to train the person on how to do it, etc. Do you see that sort of journey evolving as well?
Absolutely, Nikesh. Trust me. Um, in one of the hospitals I go to, the HN Reliance Hospital for that matter, everything is digital. All notes, investigations, reports, everything is digital. It's online. It's a completely paperless hospital.
Hmm.
Now, if I have an associate who works with me. I have another assistant doctor who comes with me. They are the ones who enter the data, because if I were to spend time seeing the patient, examining the patient, and then sitting on the thing and entering the data down, it's going to be, I'm going to take a lot of time per patient. So if I have someone who can enter the data in, it'll be extremely efficient, extremely great, helpful for us. And I'm sure a day will come when we will have physician assistants who will basically be experienced in entering data, extracting data, and also in terms of how to sort of get the whole thing. Today, what happens is, though the data is all digitized, to get information out of the system is a little difficult. It's a little challenging at times. So I'm sure this is going to be the future as far as we are concerned. As we get more and more digitized, we get more and more medically safe, and it becomes the need of the day that the hospitals have to follow certain protocols, and hospitals have to follow certain ways of documentation.
Yeah, yeah. No, and we are hoping that some of those people do come from IKS. No,
I'm
there are.
sure. I'm sure. I mean, trust me. If you expand into the phase of Indian healthcare, you'll find a lot of hospitals who are takers as far as this is concerned.
Sure.
It won't be difficult.
Dr. Janvi, are you back with us? If you can hear us, you can continue where you left off.
Yeah, are you able to hear me now? Are you able to hear me?
We're able to hear you. There may be a little bit of a lag, but yeah, we can hear you okay.
Hello?
We can hear you fine,
So if I'm
Janvi.
audible right now, so can I continue with the question that you had initially asked?
Please.
Yeah, great. So yes, so initially you asked me, can you hear me? So initially you asked me about, is my medical knowledge helping me with the clinical documentation? So yes, it is definitely helping me with clinical documentation or medical terminologies and medication, diagnosis, treatment plans. So without our medical knowledge, I don't think we'll be able to grasp those things. And also, the holistic approach of US physicians, they look at so many things. So definitely, it keeps us on our toes, whenever we listen to these audios, and our medical knowledge helps us with all that. It's a two-way process where we learn their line of treatment, and it's our medical knowledge that helps us do our optimal.
Yeah, Nikesh, I'd like to add a couple of things here. I mean, we're listening to both the doctors. Where we lack in medical practice, where seriously we lack a little bit, is following evidence-based medicine, and also to a certain extent following guidelines. Though they are now coming into shape, where medical practice here is also, a lot of practitioners start following the guidelines issued either by the American College of Cardiology or the European Heart Association, or the Indian fora, the Indian groups. That's where I think the people who do this will gain a lot of insight into how you manage patients based on evidence-based medicine and based upon protocols. I think that's a great advantage to people, to the youngsters doing these sort of jobs, in terms of working as background physician assistants. I can call them physician assistants because they're doing the job of
Yes.
doing the job actually doing the job of collating everything and putting it down on record. So it works both ways. They are getting help. The doctors there are getting help from you guys in terms of reducing their workload, increasing their amount of time that they spend with patients and in clinical practice. At the same time, people here also get to learn how to manage patients within the framework of what is available to us, and what knowledge is available to us, and how do we go about in a stepwise manner, in treating these patients. Because what we see today is a lot of youngsters who come out of come out of college, get into practice, and suddenly you're faced with a different situation where textbooks are different, practice is different. And I'm sure Dr. Pooja and people will agree to that when they come into practice, that what they learn in college doesn't necessarily apply to medical practice. You need to have a certain continuum in your mind as to when you see a patient, how do you go about treating that patient? 1, 2, 3, 4, 5, 6 different steps. And that's where these guidelines, these evidence-based medicines come into practice. And that's very much evident in the US, where you're not supposed to prescribe a drug out of, just because you think it is effective and you think it works. That's going to be a great help to youngsters doing this in the initial courses, in the initial few years. It'll definitely help them get that sort of basic right in the body.
Good. You're actually helping me tee up my next question. But just before I do that, I see some messages on the chat. If you guys want to post some questions that are relevant to this subject, please do that. And if we have time towards the end, we'll do our best to answer them. So whoever has a question, just put that in the chat box. It will be visible to all the panelists. But yeah, Dr. Pooja, let me come back to you. Like Dr. Menon was saying, that as you experience the clinical documentation with the level of sophistication that we see in the US, given the evolution of evidence-based medicine, if somebody was a practicing doctor in India, and I know some of our IKS colleagues actually do that, right? They work at IKS for a good amount of time, their 9-hour day, and then go and practice. Do you think it can help their practice? That's number one. And two, do you also think that it can help deliver better or safer care?
Yes. So, Dr. Nikesh, I was actually, about to, when Dr. Menon said about it, I was like, yes, definitely it helps. People who are practicing after, they still continue to practice. But asking to me about it, with my personal experience, if you ask me, I've been managing orthopedics or some of the specialties like these, and we can actually relate it to our patients around, like maybe your family or your friends, or even the patients who call you the older patients when you have treated them. So, it really gives a better approach. And as Dr. Menon rightly mentioned, during our college days, we are so much focused on the theoretical part of it. Practice is so very important to, understand, or how should be your approach towards diagnosing a person. What should exactly, instead of having a excessive use of medications, what can your actual approach be? That has really helped. And listening to these patient doctor conversations and learning from them, it's as good as practicing medicine. So that has really helped. And we have experiences where it has improved our practice, clinical practice, to a larger extent. So I think, yes, this is helpful.
What about you, Janvi? I hope now we can hear you fine. You fixed your internet issues, but if you can hear us, then yeah, you feel free to respond as well.
Yes. So can you just repeat the question, because I missed the question?
Yeah, I was saying that as you guys have experienced the way clinical documentation is done in the US, for somebody who is practicing in India, and let's say you are also doing this work that you do at IKS and you had your own practice, does clinical documentation have the possibility of improving your clinical practice, both in terms of just your knowledge as well as delivering better or safer care to patients? What is your view on
Definitely. So here in India, we have started adopting technology a little bit. However, it's not extensively used as much as they use it in the US. The smallest of the entry about their vitals or their weight is accurately done at the moment. 2 years down the line, 3 years down the line, we can definitely refer back to these records. Whereas in India, we are still, using paper to document, and there's a lot of chance of our papers get destroyed, misplaced, or not being available when they're, actually need. And so definitely there's a lot of scope of improvement in the Indian documentation, and we can use the technology. I mean, we are having access to the EHR, and the way they are using it to the fullest, there's a lot of scope for us to do that too. And so that down the line, 5-10 years down the line, when we look what the patient was treated for, or was the patient compliant with the treatment that was suggested, or was something done against medical advice. So all these things come in handy if we use technology rather than be dependent only on the handwritten entries that we.
Okay. And Dr. Menon, what about sort of your view as, like you said, the electronic medical systems are getting more and more sophisticated. In India, a lot of the hospitals are implementing them. Of course, the documentation burden is going to continue to rise. But do you see that also improving patient care?
Definitely improves patient care because there's a system that is followed when you have that. And this still needs a lot of refinement because we still have issues in certain situations in prescriptions on a daily basis, etc., where for example, what you're taught in medical college, the way you prescribe medications, that is something which that has to be integrated in most of these systems, because sometimes it becomes difficult for us to know whether the treatment that is there is something which has been which is going on in the patient, or is it there on the record just because it was entered on day 1 and subsequently deleted on day 4, but it still shows up on the system. So that's something which I think it will require a little bit of cleansing up and a little bit of integration before it becomes much more user friendly for the doctors. The second thing is training people. I mean, when you have people, see, most of us shy away from this because of the time that we have to use to get knowledge out of the system. But once we get it, it becomes so integral to the treatment of the patient that patients definitely get better. I mean, the management definitely gets better when you have everything collated. For example, if I can sit at home and have a look at the X-ray chest of a patient in a next hospital, or the ultrasound report of a patient, or a 2D echo a live 2D echo sitting on my laptop or on my phone, it's going to change things drastically, because otherwise I would have seen the X-ray or the thing only tomorrow morning. Because I'm trusting the knowledge and the integrity of the person sitting there to decide the treatment of my patient. And trust me, what happens in a lot of places is, and this happens maybe worldwide, the way patients are treated in the morning and the way patients are treated in the nights are vastly different. So we tend to overlook certain reports that come in the night. We see them only in the morning, not understanding that there is a 8-hour or 12-hour gap between that report and us seeing the report. Would that have happened in the morning time? No. You have acted on the report immediately. So this clinical documentation, which can be digital and which can be transported via your via the internet to our homes, will definitely changes treatments. And so I think it's something which, if it is implemented properly, well and good. But what I also see is that because it's something new to our setup, we are spending a lot more time on the computers than being with the patient, which is something which the patient also realizes, and we also realize that we tend to spend less time with the patient and more time on documentation. That should not happen. That is where the role of people who can help us with the clinical documentation comes in, where I just say, I have a voice recorder, I just record it, and it automatically gets integrated into the system by someone.
Correct.
So that makes it much, much more easier. I can do a lot of work. I can put my thoughts into action. I can put my thoughts into words, and I can make sure the patient gets whatever benefit out of it.
Yeah, and I think particularly in India, with the scale that we have, anyway, we are not able to spend enough time with the patient, right? Because you see many patients that you're anyway rushed, and then on top of that, if you're on the computer, and we hear that even from physicians in the US who are probably seeing 10 to 15 patients a day, right? And when we tell them that in India, a typical general practitioner sees upwards of 50 or more patients, they wonder, like, how do you even do that? But I think also as the workforce is starting to become more mobile, right? I may be in one city this year and I may go to a completely different city for the next 2-3 years. Having something that's digital rather than carrying all paper, I think also helps the provider who's continuing my care, in another part of the geography, pick up from where somebody else has left off, and you don't make errors or side effects of other drugs that were sort of going on, and multitude of issues. And we see that in the US as well. But like you said, I think there's some work for the technology to be integrated where it's seamless, that somebody can easily pick that up, as opposed to having to log in 5 places to get that data.
If I may interrupt here for a minute, you see,
Yeah.
when we see patients, I mean, I see patients from, say, 2000, from 1996.
Yeah.
Okay. This is 24 years down the line. Patients have been coming to us every 2 years or 3 years. I have to still go through those papers.
Yes.
Okay. And those papers, I mean, sometimes you don't get the records. They have lost their papers. They have moved houses. They have lost papers in some floods or rains or whatever. And half the times we don't have the information that we need from those many years ago. Forget about that. Short term, 1 year. If I were to compare a patient's reports, what was his cholesterol before treatment? What was his hemoglobin before treatment? What was his hemoglobin at this point of time? What was his creatinine at this point of time? I still have to sit and go through each individual reports.
Sure.
Whereas if if we have a clinical documentation which is digital online, and I just type in, I just move in creatinine, and I get a whole record of the graph, makes a life much more easier, patient's management much more easier.
Yeah, and even a summary, right? And we do a little bit of that. Maybe for the next session of this, we'll pick up some chart prep. But Pooja and Janvi, before we close, I wanted to come to you and ask you that how do you respond when your family or friends ask, like, "Ye kya kar rahe ho?" Right? You became a doctor. Ye typing job hai. No, this is not what you were sort of meant to be. How do you respond to that?
So, Dr. Nikesh, actually, it is all how you take your job, how well you love your job. That's I feel that's the most important thing. Answering to anyone, when you are confident enough to know what you are doing, what exactly you are contributing to coordination of care for the patients, helping out in documentation, and it's like a physician's work. So I think my response was always has been that I work for the US healthcare, and I am pretty much updated. I am very much updated with the current protocols that are going on in the field of medicine, and that's how I take up interact with the clients there, the physicians there, and it is pretty much a medical oriented work that I am doing. So I think that's how I manage it. Dr. Nikesh, I just missed your previous question. You had asked me to how you need really better, or how the documentation serves better. I think most of the points we have covered, but I just wanted to add one thing. In the US, the patients also have the access to see the documentation that is done. So just in case if they forget on the medication regimen, or maybe some other treatment options are given to them, say take steam or something like that, what will be the regimen for it? They can just refer to it, and they can follow those instructions instead of calling the physicians or calling someone there, and that gives a accurate treatment. They might not miss on any of the parameters that are suggested or recommended by the physician. So that's one thing which is really helping in the document, having an accurate documentation of so that's one thing which I missed. So
No, good. I'm glad you added that. Janvi, what about you? How do you respond to that question when family members ask, what kind of job is this? You became a doctor and you're doing this. How do you respond to that?
Yes, so Dr. Nikesh, initially when I was working in the field, can you hear me?
Yes.
Yes. So initially when I was working in the clinic, I would want to grow in that organization, in a particular organization. I'm working with a chain of a healthcare system, and the next step, or the next whenever you look at growth, you have to go into an administrative or a managerial role. And so my family was very much aware of it, that the next step would be something like that. And here at IKS, I'm exactly doing that, and I think I have gone to the next level. So I will not say that I'm doing a non-clinical job. This is very much clinical, because we are constantly working for the patients, and for the US physicians, we are in touch with them, and I think being in touch with them and listening to the feedback
Okay, we seems like we lost her. Any closing comments?
One thing to add. I'll just add
Yes.
one thing here. With all these clinical documentations, you have to look at the Indian patient subset. The Indian patient subset is where a patient wants the doctor's attention
Positive
most of the time.
feedback from the providers, when we connect with them, that is something.
Okay. Yeah, go ahead, Dr. Menon. You're saying in the
In the Indian scenario, patients want a one-on-one with the doctor. I have worked in many years ago in Australia. I worked in Dubai also. While I was practicing, I used to go to Dubai to practice. There, in a lot with the difference is that Indians want a one-on-one with the doctor. They don't. They would rather that they spend more time talking to you, and they get upset when you start typing stuff or keep writing in their presence. So we have to have an integration of the systems where the doctor still can spend time with the patient. At the same time, his clinical documentation and his notes are being taken care of.
Correct. No, fantastic. And on that note, I know we are a little bit over time, so we will draw this to a close. But again, I just wanted to remind everyone that this is a bi-weekly series that we plan to continue on a wide variety of topics centered around the theme of transforming healthcare. And our mission is really to create more awareness around different careers that are available to clinicians today that don't necessarily have to be non-clinical. They are alternative clinical careers. So with that, thank you everyone for tuning in. Please like, share, subscribe, as they say, and we will see you in a couple of weeks. Thank you, Dr. Menon.
Thanks,
Dr.
Nikesh. All the best, Dr. Pooja and Dr. Janvi. Thank you.
Thank you, Menon. Thank you. Bye-bye. It was good talking to you.